Examination. Lipoma. A lipoma is a cluster of fat cells which become overactive and so distended with L1 fat that it produces a palpable swelling. This is the commonest tumor of the subcutaneous tissue. It may occur anywhere in the body, hence it is known as UNIV, SNL tumor, but mostly seen in the back of the neck, shoulder and the back. Though subcutaneous lipoma is LHC commonest and will be discussed in details, yet the students should keep in mind that lipoma may develop in other places, for example internmuscular, subfacial, nostril, subsero-11s, submuco-11s, GL tract, LNTRN, NRFIC 11 LNR, S11 bsinovinal, S11 BD11 RNL or extranernal, spine. There are mainly 3 varieties of lipoma: L. Encapsulated variety, 2. Diffuse variety and 3. Multiple lipomas. 1. Encapsulated subcutaneous lipoma. This is the commonest variety. Pathologically. 48 Figure 3.55. Fibroma of the foot. A manual on clinical surgery. It consists of normal fat which contains overactive fat cells and is arranged in lobules separated by fibrous septa and enclosed in a delicate capsule. A lipoma is usually small but it may attain very big size. Lipoma may occur at any age, but it is rarely seen in children. It is a painless, slowly growing, lobulated and soft swelling. It can occur anywhere in the body, though more commonly seen in the neck, in the back, around shoulder and in the upper limbs. The overlying skin is usually of normal color. Only in case of very large lipoma the skin may be stretched with dilated veins over the tumor, but such feature is more common in case of neurolipoma. The surface is smooth and lobulated. The edge is definite and slips under the palpating finger, which is known as slip sign. This sign is helpful to differentiate this condition from a cyst, in which case the edge does not slip away from the palpating finger, but yields to it. Consistency is soft but does not fluctuate. In normal body temperature the fat remains almost in semi-liquid condition and consequently slight fluctuation may be elicited, and thus lipoma is often called a semi-fluctuant T swelling. Though lipoma does not contain fluid, yet a large lipoma may transilluminate with the art from ordinary torch. A lipoma is a freely mobile swelling over the deeper structures such as muscles and fasciae. So a Figure 3.56, a pedunculated lipoma can be easily moved. Lipoma at the nape of the neck over a taut underlying muscle either along its long axis or at right angles to it. LT is not attached to the skin, so that the skin over the swelling can be pinched up apart from the swelling. But there are fibrous strands which connect the capsule of the lipoma to the skin, and that is why when the skin overlying the tumor is moved, there is dimpling on the skin. Sometimes lipoma contains dilated blood vessels when it FLG 3.57, showing how a lipoma is freely mobile over a contracted muscle. The trapezius muscle has been made taut by shrugging the shoulder up against resistance with one hand, and the lipoma is moved with the other hand is called neurolipoma. If a lipoma contains excessive amounts of fibrous tissue, it is called fibrolipoma. When a lipoma contains nerve tissue, it becomes painful and is called neurolipoma. Examination of a lump or a swelling. 49 Complications. A lipoma when present for a long time may undergo certain changes. This is particularly true in cases of lipoma in the subcutaneous tissue of the thigh, buttock or retroperitoneal lipoma. Such changes are I. Myxomatous degeneration, 2. Saponification, 3. Calcification, IV. Infection, V. Ulceration due to repeated trauma, and V. Malignant change, liposarcoma, which the students should always keep in mind. Certain authorities believe that lipoma never turns into malignancy. If liposarcoma does occur, more often seen in the retroperitoneal tissue, it arises de novo and not in a benign lipoma. 2. Diffuse variety. This is quite rare and does not possess the typical features of lipoma, hence it is often called Pseudo Lipoma. It is seen in the subcutaneous and intermuscular tissue of the neck and gradually may extend to the cheek. There is no capsule of this tumor. It hardly gives any trouble barring being unsightly. It is often found in persons taking excessive alcohol. 3. Multiple lipomas. It is often called lipomatosis. The tumors remain small or moderate in size and are sometimes painful, as these contain nerve tissue and are called neurolipomatosis. These are mostly seen in the limbs and in the trunk. Lipomata of the different sizes and shapes may be seen. Macroscopically and microscopically these are not different from solitary lipoma. Derkheim's disease, adiposis dolorosa, is a variety of this condition in which there are tender lipomatous swellings particularly affecting the trunk. This is more common in women. Neurofibroma. This tumor contains both neural ectodermal and